Physical plant and equipment is today's topic of discussion. And this we'll talk about what is PPE, what is physical plant and equipment. We'll introduce it further. We will elaborate a little bit more. Then we will make people understand through an example that what is PPE, what is example of this PPE. After that, through that example, we will elaborate it further for you guys. In short, we'll make it super duper easy. Let's get started from the very first point. PPE, physical plant and equipment. What is actually this title standing for? Very simple. In short, it is actually a necessary infrastructure required for furnishing a particular service. Now, what this statement actually means? Simple, very simple. Just concentrate. Whenever we are actually providing a service, for that we need a particular structure, a particular plant. So if we have a plant, a particular structure, then through that structure, through that plant, we can easily provide a particular service to humans. If we talk about humans, okay? Well, here we'll give you people about example of the hospital pharmacy. Now, in the hospital, we will be having a hospital pharmacy. Through this pharmacy, if we implant this pharmacy, now from this pharmacy we can get the services, whatsoever the services are in sense of medication and blah blah blah. Just put that on. So in short, now what is physical plant and equipment? Is simple. It is actually an infrastructure. You can say a kind of plant from which what we get a particular service, or which is providing us particular service. Now here, furnish means to provide. It does not means it does not mean a furniture. It means to provide. Furnish means to provide. People are actually placing this furnish in sense of furniture. Forget about that. Coming to the point once again. Now, what is PPE? Physical plant and equipment. Simple. It is an infrastructure that is actually required to furnish particular service. Simple. In simple words, a plant that is requiring a particular, that is providing a particular service. A plant providing a service. Just remember these two words. Plant providing a service. Simple. In simple words. Well, further, you can write this also as an introduction or definition. Now, what this infrastructure actually stands for, what does it mean? Let us elaborate this a little bit more now. Infrastructure is actually the location, the physical space, equipments, space allocation, furnishing a particular service. Now, what all these points actually points to, or what do they mean again? Simple, here we have a particular area. Now, in this area, we point out a particular location, that this is the location. Now, in this location, we consider the space of this location, that how much space this location has in this area. So after that, we place some equipments in this particular area. Those equipments, when they are placed, then they are given further. They are considered, the space allocation is again considered for these equipments. First of all, we'll find the location. First of all, we'll be having area. In the area, we will point a location. In the location, we will consider and we will find, we'll come to know the space of this a particular location, that how much space is available for a particular plant. So if we want to implant a plant somewhere, we must consider first of all the location. Then the location, after the location, according to our demand, we must see the space, whether the space is available or not, how much space is available, whether space is suitable or not. So we will go for the suitability of the space. Then we will consider the space for the equipments. So according to our demand, if we are implanting a plant, that plant will actually need some equipments. So according to that, then according to those equipments, again, we will see that how those equipments will occupy spaces. So in short, we will do the space allocation of the equipments also. After all, so when the entire plant is constructed, so then from that plant, we will be having a particular service. Example, like very simple, consider that physical plant for us right now is actually a pharmacy. It is actually a physical plant. So we want to implant this plant in the hospital. So then this is called as hospital pharmacy. Now here we have a hospital. Simple. This is now our hospital. In the hospital, what will we do first of all? If you want to implant the hospital pharmacy, we will first of all do planning. Now here, different plannings are being done. So simple planning, then complex planning, then strategic planning, then architectural planning. Means in short, plannings are done. Plannings in sense of constructing or implanting the pharmacy plant. So what we do then, when we are going for the plantation, means if you want to implant, We will first of all point out the location in the particular area. This is the area of the hospital. So here, for suppose we want to implant the pharmacy, hospital pharmacy. So now we got the location. So in the location, then we will go for the space. Now location is here. Remember, if the hospital is small, regarding location point of view, if the hospital is of small size, location must be on the first floor. First floor is must. And if the hospital is of large size, then there will be multiple or sub pharmacies available. Those sub pharmacies will be having connection with the main pharmacy, or we can say a big pharmacy in simple words. So like this, the location is depending upon the hospital. Again, if it is small, so first floor is must. First floor is must. So on the first floor, we got the location. Then we'll go for the space. That how much space this particular hospital pharmacy actually requires. After that, this space will be actually considered with respect to the workload. That how actually workload is. According to that workload, you know about the workload, entire process actually, the work is placed in the workload. In the workload, we actually place all the steps that are actually required to produce or to formulate a particular formulation for the particular patient. What we do, we take the raw material, we then go through entire processes. We make the end product, then we encapsulate that product, or we provide any other structure to that product. So after that, we do the label. So from the initial to till the labeling point, this all steps, according to the steps, according to the requirements, the space must be considered, that how much space is actually required to have functional pharmacy of our demand. Then we will go for the equipments allocation. So it is obvious that if we want a plant, we must have a space. Location is the first priority. Okay, we must have location. Then in that location, we must have particular space for our pharmacy, and then that space we will be actually allocated with by equipments. So then we will place equipments hereby. After the equipments, when they are placed, now remember, equipments are of different types available with us. Some are movable, some are immovable. So we will purchase, then we will allocate all these here. After that, we will maintain some other utilities also, like light, water, etc. So we'll maintain all these all. So after all, we will be having at the end of the day a kind of what we say, a plant. So now this plant will be named as a pharmacy. After that, when everything is being done, location, space, equipment, and then equipment's purchasing, equipment's allocation, after that, at the end, we'll be having a service. So when all these things are done, so we can say a kind of plant is completed. Now when the plant is completed, if it is providing us a kind of service, so this is actually called as physical plant and equipment. Physical plant and equipment. Physical plant is constructed, equipment are placed, equipments are placed. Then after that, this through these equipments from this plant will be actually providing a service to the nation, to others. So now this is actually called as physical plant and equipment. So now the service here will be of what sense? Simple. We'll be having a pharmacy, functional pharmacy. Now pharmacy will provide you what? Simple medication and somehow counseling regarding patients. If there is a clinical pharmacist, physician, nurse, etc., etc., so all they will be consulting this particular pharmacy. Patients will be consulting thereby. So in short, whatever comes in your mind, beneficial, accurate regarding the pharmacy, just place all that in the services. So then services will be actually provided to the public. Now let's recap or revise it in short, summarize it. Summing up our entire lecture in just some words. What is PPE, physical plant equipment? Simple, it is actually infrastructure that is required to provide particular service. Okay, furnish means to provide. So we have a plant that will provide a service to us. Here I told you people about the plant is pharmacy. So the services by the pharmacy provided to us will be actually named as physical plant and equipment. Okay, I think it's clear now. So in the infrastructure, I told you guys we must be having location, physical space, equipments, then their space location. After that, when all these are actually placed, being summed up, you can say placed in a place, implanted, so they will provide us a particular service. Example, like if you want to have a physical plant of the pharmacy in the hospital, means if you want to have hospital pharmacy, for that we will do planning, we will go for the location. If it is a small hospital, we will go for the first floor. If it is big hospital, then we will construct some more sub pharmacies. Then all sub pharmacies will be having connection with the main pharmacy. So then after that, when the location is identified, we must go for the space, how much space is needed. Okay, first of all location is must, then space. After that, equipments must be purchased, then those equipments must be allocated, and at the end, when all things are done, so the plant is actually now prepared. From this plant we will be having a service is what pharmacy provides multiple services to the public and to the entire health sector. So in short, this is actually PPE. I hope you got. If still you have confusion, drop in the comment box. Thank you for watching.